Alright, so for the next drug which we'll get to discuss, it's pharmacology. It's what is known as a Cefazolin. So look at the pharmacology of Cefazolin, which is another, cephalosporin antibiotic. So for the Cefazolin, we're looking at its pharmacology. Okay. So for Cefazolin, we said that it's a first generation cephalosporin antibiotic. So it's commonly used for surgical prophylaxis. Like they want to do a surgery for you, so they now give you the drug before the surgery, so that no infections will kind of like come in. Do you understand? So mechanism of action is the cephalosporin will inhibit bacterial cell walls, so to stop the bacteria from forming properly. Do you understand? So it does this by binding to penicillin binding proteins. So this will now disrupt that process that the cell wall could have formed properly. So it will now lead to cell wall instability. So the microorganism is now prone to what? Death. It's all sorts of attacks. You understand that kind of thing? So that's what we got there. So spectrum of activity, it is highly effective against gram-positive bacteria, okay, such as other Staphylococcus aureus, Streptococcus pyogenes, Streptococcus pneumoniae. It also has activities against all those Escherichia coli, Proteus mirabilis, Klebsiella pneumoniae. Okay. So though its gram-negative coverage is limited, okay. So pharmacokinetics, you administer it parenterally, okay. That's like through all those intramuscular or intravenous, okay. Now this is because it has a poor oral absorption, so it distributes well in most tissues, fluids, including bones and joints and all of that, okay. So protein binding is high. So about 80 to 85% protein binding. Okay, so it undergoes minimal metabolism and is primarily excreted on change in urine. So the elimination half-life is approximately 1.8 hours. Okay, so it can also be prolonged in a patient that the kidneys are not functioning optimally. So clinical uses is widely used for surgical prophylaxis. Before surgery, give it to a patient just to prevent any infections that could have come up in the surgeries, right? So it's also used in treating all the skin and soft tissue infections, bone infections, urinary tract infections, and also respiratory infections.